interdisciplinary integrated seminars and conferences. Thereupon, on the occasion of Sushrutha Avabodhini 2.0, organized by Sushrutha Ayurvedic Medical College and Hospital in collaboration with S. Vyasa University and Vishwa Ayurveda Parishad, Karnataka, we welcome one and all.
Now, we would like to invite our speaker, Dr. Pangala Murulidhara Bhat, sir, chairpersons, Dr. Shailaja Kumari ma'am, Dr. Madhava Diggavi sir, to the dais. Professor and HOD Chandrakala ma'am, Kriya Sharira department, to welcome our speaker. We request Chandrakala ma'am. I request Dr. Prabhavati ma'am, Professor and HOD RSBK department, to welcome our chairpersons. I request Prabhavati ma'am to welcome our chairperson, Dr. Madhava Diggavi sir. Dr. Pangala Murulidhara Bhat sir has graduated from Gulbarga University and did his post-graduation from Mysore University. Sir has worked as a lecturer at SDM College, Hassan. Also, sir has delivered various lectures to students of reputed international universities like Nami Ayu Medical Center, Moscow, and Thames Valley University, London. Sir has served as Professor HOD at Sri Kalabhairaveshwara Ayurveda College, Bengaluru. Sir has started his private clinical practice, a leading clinic Sudharma Healthcare, RR Nagar, Bengaluru. Also, Sir is a guru at Rashtriya Ayurveda Vidyapitha under the Ministry of Ayush, Government of India for CRAV course. We welcome you to the session, sir.
We are glad to welcome the eminent scholar in the field of Kaumara Bhritya, Dr. Shailaja Yurao Madam, Principal STM College of Ayurveda, Hassan. Madam is a consultant at Vasishtha Ayurveda Institution. Then Madam is a member faculty of Ayurveda for Department of Kaumara Bhritya, BHU University. Madam is a chairperson for Purchase Committee, Hassan. Madam is a member of IKAC and NABH Committee, SDM College of Ayurveda, Hassan. Madam is a researcher and expertised in cerebral palsy, bronchial asthma, seizure disorder and child nutrition and many more. Madam has been guided more than 40 post-graduation students and also guided more than PhD scholars. Madam has been awarded with Akshara Abhisheka Award and Madam is one among the top 10 doctors of STM Hospital for 12 consecutive time in SDM College of Ayurveda, Hassan. Madam has also been awarded with Kashyapa Ratna Award by International Academy of Ayurvedic Physicians and many more. And Madam has also and resource person for more than 62 national scientific seminar. We're glad to have you here on this seminar, Madam. Welcome you, ma'am. Now, coming to the next chairperson, Dr. Madhava Diggavi sir. Sir is a principal in the Taranath Government Ayurvedic Medical College and Hospital, Ballari. Sir has completed undergraduation from Ayurveda Mahavidyalaya, Hubli and post-graduation from Gujarat Ayurveda University, Jamnagar, specialized in the field of Vajikarana Tantra. Sir has 30 years of teaching and training experience and has delivered more than 155 guest lectures in various national and international conferences. Presently, Sir is heading WHO CSA regulated andrology lab in clinical research. Sir has published in various reputed national and international conferences and journals. We are glad to have you here, sir. I request you to chair the session.
So now let's begin the session. I request the speaker to lead the session.
Okay. Okay. Respected Dr. Shailaja Madam, Dr. Madhav Diggavi sir, Dr. P.N. Rao, and all the dignitaries on and off the dais. It's my pleasure to give a talk. My clinical experience in this degenerative disorders. Let me start with the, ready now? Okay. Next slide. Only there like that. I can go to the next one. So I am going to talk about the introduction to degenerative diseases, various types of degenerative diseases. Probably I can have one hand mic. Diagnosis of degenerative diseases and management of degenerative diseases is 4 area I'd like to talk. Next one, please. So, introduction to degenerative disease. Next one. So, you all know degenerative disease is a condition that alters the cell or tissues or organ structure or its functions over a period of time, leading to cell death and also loss of functions. The causes of these diseases are unknown. Some of the factors related to this includes aging, wear and tear of the body, improper lifestyle, etc. The next one. So Ayurvedic approach for degenerative disease, we always say the Sharira itself, Shiryate Anineti Sharira. Degeneration happens every moment. Meantime, Deha is there, Vardhane, Sharira is Shiryate Anineti Sharira. Like that, in disease point of view, if you see Jvara, Pururupa itself, we can see a degeneration process. There he says one word called Daurbalya. In the commentary, Chakrapani says Daurbalya means Mamsa Apachaya. Okay. So Mamsa Apachaya. When Mamsa Apachaya means, further commentary says just like a Mamsa Kshaya. we have to see Mamsakshaya Lakshanas. Mamsakshaya Akshaglanihi is the one of the Lakshanas. So Akshaglani means Indriya Glani, Indriya Daurbalyata. So Indriya means Jnanendriya, Karmendriya. So in the Jvara Pururupa itself, we have a lot of sensory and motor neuron function deficit. So we can see Jvara Pururupa itself, some people have a loss of smell perception, one Indriya is gone. Like that, we can see tactile perception or some of the other sensation may be lost in the Pururupa itself. So usually here, because of the Vata vitiations, which happens because of Shuddha Vata Janya or due to Avarana Janya. So various types of degenerative diseases. One is neurodegenerative diseases where the neuroatrophy or nerve cell death happens. Second one is genetic disorders. Here majorly it's genetically predetermined, like muscular dystrophy, retinal degenerations, or sometimes genetically predetermined disease like psoriasis, like that of disease. And musculoskeletal system related degenerations like that of osteoarthritis, disc herniations, these kinds of disease. And the cardiovascular system related, like, because this is a lifestyle related disease, more common is the vascular blockages leading to different kinds of stroke, ischemic strokes, either cardiovascular or cerebrovascular is going to happen. Atherosclerosis is the main reason. Then sometimes because of this cardiovascular system, the venous thrombus may lead to pulmonary embolism or any other blockages leading to degenerations. And neoplastic disease. These are all the, majorly this happens. Some of the triggering factor every person will have 16 types of oncogenes. Everybody have it. So if any stimulants is given, that particular of cancer is going to pop up in our system. Just like our bija, kshetra, bija, that concept it is. So initially these type of cancers are localized, sometimes it distracts. So it could sometimes the benign tumor like that uterine fibroids, osteophytic changes, these are also benign type. Malignant type may create a bigger problems. So diagnosis of the degenerative diseases. So the mainly blood test, genetic test will be helpful to understand these degenerative changes. Sometimes they also take the biopsy studies, hair and skin and amniotic fluid, that's also very important. Then DNA study, chromosome studies, or different kinds of proteins also helpful. For example, ANA profile, homocysteine, these kinds of protein also helpful to diagnose the conditions. And genetic test, that's also another one. So further, if you go further, the inflammatory markers like CR-active proteins and homocysteine level, immunoglobulin test, tumor markers, our CT, MRI, PET scan, this is also helpful for the diagnosis. Now the management point of view, I talk from the Ayurvedic point of view. Only diagnosis point of view, sometimes we need a help, majorly to understand. I'll let you know why it is. First one, I am bringing one case of pyloric stenosis. The globus pallidus. So when I was doing my final year post-graduation, I got an opportunity to study under Dr. Ishwar Reddy. Sir know him well. So sir was put a one case note that the patient had a trouble in swallowing food. When patient had a trouble in swallowing food, then it was almost for the 2 years. She is finding difficult to take food. She is losing weight. So in this case sheet he has written Vistabdajirana and he has put Amapachana and started giving treatment. He started giving Snehapana. Snehapana itself patient started responding. Earlier this patient has seen ENT doctors and including psychiatrists, because this disease is considered as one of the psychological issues. So globus hystericus or globus pallidus. So this is the name, but sir has diagnosed as a Vistabdajirana. I asked him why it is so. You read the symptoms of Vistabdajirana. Vistabde, Shulam, Admanam, Vividam Vatavedana. Any Vatavedana? Yes, Vishtabdajana. So he handled that way. So whenever this type of cases comes, the diagnosis is very simple. For them it is very difficult. Give anti-anxiety medicines because this leads a lot of issues for the patient. They lose weight, lose confidence. And these symptoms, nowadays it has been mentioned that triggered by GERD or some of the acidity symptoms or phobia also triggers these symptoms. The next one is GERD. Why I brought this disease in the degenerative disease? This is not a gastrointestinal disease. Why you are putting this as a the disease related to the degenerative disease? So one thing, as I mentioned earlier, Jvara, itself we can see a Dhatukshaya Lakshanas. There is degeneration. Second, after Jvara, if you see the Purana Jvara and all, that leads to different kinds of disease. Instead of exhibiting Jvara symptoms, Deenata, Shvayatum Yati, Pandutam, Nannakamatam, Kandurutkoita Pidakaha, like that, it may create Panduta, it may create Kamala, that kind of disease. That means it may damage further organs like liver, spleen, may lead to different kinds of degenerative diseases. So, after the Jvara, the next chapter is Raktapitta, Jvara Santapat Raktapitta. The next chapter is Gulma. What in Gulma he says? Jvara, Vamana, Virechanadyehi, Karshito Karshitaha, Vatalan Annan Pibati, or Pittalani Annani Pibati, or Kafajan Annani Pibati. He lands up in Gulma. I wonder, none of the postgraduates takes Gulma case for their case studies. Because they are forgetting, oh, what is this disease? We can't take these kinds of disease. How to diagnose? Lot of questions will be there. It is easy to diagnose Gulma. Gulma is Pururupa itself, he says, Udgara Bahulya, Purisha Bandha, Tripti, Akshamatva, Antra Vikujanani, Atopam, Admanam, Apatti Shaktihi, Asanna Gulma Sevadantli. You see, any of the GI diseases, symptoms will be Udgara Bahulya or Praseka, that kind of symptoms, Admana, Atopa, all GI from top to bottom, you can see either Udgara Bahulya will be there or Apatti Shakti loss or Praseka, all these Lakshanas will be there. Hence, it is easy to diagnose Gulma chapter easily. So, what he says in Gulma, already Karshana is there. When Karshana may happen, for example, you are giving medicine for a Jvara. Nowadays, simply viral fever also people give antibiotic. Okay? I don't mind giving paracetamol for a patient because paracetamol is a aniline compound. Aniline means in Nilini plant. Nilini is our drug, indigo tinctoria. So, okay, that's a tiktarasa, langanam swedanam kalo yavagu tiktakarasa to be given. But where to be given? You can't give in Vata Jvara. This Nilini plant has been recommended for Vishama Jvara or Agantu Jvara, not for the regular Jvara. We have other choices. Other lot of choices there. Amrita Tarkasha is there. In viral fever, it's considered as a Vata Jvara. You need not give Tiktarasa. So this is a basic chain where we are creating another GI disease while treating the Jvara. So what we have to do, if at all you are given antibiotic, at least you should follow just like a Shodhana principle. After Shodhana, you have to give a Mandapayadi Kriya. Then they will recover faster. If not, GI disturbance further continues, leading to different kinds of disease. You can see after taking course of antibiotic, they comes with the bloating, distension of abdomen. Their gut flora is gone. Further, at that time, they consume regular diet. They may come with the Ajirna Lakshanas. Vishamagni or Mandagni or anything, depend upon what type of food they consume. So this is one condition, GERD, reflux disease. It's a both. It's a changes happens at the level and the so intensive reflex will be there. That specific esophageal orifice is getting weakened. So it's a neuromuscular or a sphincter related issues. How to manage, I'll let you know. I'll continue with one more. Another one is pyloric stenosis. It is a gastric outlet gastric outlet obstructions. So probably I'll give few examples of case, then I'll proceed. Okay. This GERD is very common, and for example, pyloric stenosis, if surgeon like the P&R is there, they prefer for a surgery. Because surgeons, they always have it. I had one recent case, I had a history of this gastric outlet obstruction. She came with, for the last 6 months, it is over, she lost about 10-15 kgs of weight and went ahead with the surgery they have planned. Somebody has said, you go there and let us see what's going to happen. So she came, I heard her story. What happened was, she's from Magadi. Recently, her daughter completed her 10th standard. When result is about to come, prior to that, when she was, usually they do boil water for the bathing, using regular woods. So she was doing it by mistake, little the kerosene fell and she got fire. She had an intensive burn and died. Because of this, she died, and next day result came, she scored more than. She is basically teacher, and last daughter is very intensive depression. That led to the problem. Because of that, she is having a intensive obstruction. Slowly, day by day, started loss of interest in food, slowly weakness, intensive weakness, no intention of taking food also. Life, she became very boring and wanted to end her life. That was her situation. So now the surgery was recommended. So what we did, we started giving first amapachana kind of madhipala, that of things. Then we started giving a little bit of snehana. Started giving snehana like Indukanta Grata, slowly Sukumara Grata, like that, like a baby dose, 1 ml, 2 ml, like that we started giving. Then we started giving a Matra Basti. Within a span of 2-3 months, she recovered. This concept has been said that all these sphincters are Shushira Snayu. Shushira Snayus are Upadhatu of Medadhatu. Medasa Snayu Sambhava. One of the Snayu is Shushira Snayu. These Nadi, Shrotasu, Mandala. Mandala Sandhis are there. Mandala Sandhis are made up of Shushira Snayu. Shushira Snayu works wonder if you give proper Snehana. So how she recovered from that complaint. So many other sphincter related issues, we can do such kind of treatment. Now another one is pancreatitis. This is the first 2-3 which I mentioned, it's coming under the Vata Gulma category. This one comes under the Pitta Gulma category. Many times liver abscess, pancreatitis, you have to treat like a Pitta Gulma, they respond well to the treatment, including the Amla Pitta Lakshana. Charaka never mentioned, only Amla Pitta word has been mentioned. But we have to treat like Pitta Gulma Chikitsa, they respond better, these kinds of conditions. So we have many cases of pancreatitis, they recover. Another case is the diverticulitis. Diverticulitis, modern system doesn't give much importance. It's nothing to worry. Unless and until diverticulosis happens or infection happens, then it has to be worried. Otherwise, need not bother. But as the old age progresses, they land up in different kinds of water-related issues like improper bowel movement, that kind of conditions. They started taking, depending upon some laxatives, laxatives like, for example, Nityam, Kayam, like that. Once again, it's a Ruksha Virechana kind of things. They land up in problem again, further Gulma increases. So these kinds of diseases, so for example, in the Gulma itself, he says, Asneha Puro Vamana Virechanam Pibati. Without Snehana, Svedana, if you are going to do the Virechana or the Vamana, land up in Gulma, that is the thing. So hence we have to give much caution while giving these kinds of management. The Matra Basti kind of things are very preferable. I had one case, diverticulitis, his large colon, large intestine, whole colon has got infected. Very intensive eosinophilic count, like something like 21, total counts of 21,000. Eosinophil counts are very high, about to get operated. He also had a renal tumor. Partial nephrectomy was done. For nephrectomy, they have opened a lot. He also had a herniography, and also now this time landed in intensive diverticulitis, infective diverticulitis. He lost weight about 10 to 15 kg, everyday fever, no appetite. So about to do surgery and put a pouch here. And earlier, my patient told, I referred earlier to a nephrologist. He saw the case, and once again that renal tumor also was there when they did the CT scan. So I said to that patient, you consult nephrologist also, gastrosurgeon also, together, because that tumor also coming. Remove that kidney also. Better surgery together. No need for another surgery later. But somehow that nephrologist had some different idea. He referred case back to me. No, go and take treatment there itself. He's a known person, very supportive for Ayurveda. Then I wondered if he said something, because he's a very knowledgeable person. He's FRSC in UK, worked there a lot, and highly philosophical. He studied Vedic, all Rigvedas, his father also Rigveda scholar. He referred back, then I said something should be done. So I treated like a Panchavalakala, Basti, Kashaya Basti, Kshira Basti, Takra Basti, like that, Shamshamani Vati, very little food like Manda Peya Vilepi. Within a span of 1 month, he started developing appetite, fever came down, bowel frequency reduced, then slowly started little by little Matra Basti, then he recovered. After the recovery, 2-3 months later, he gained weight also. I sent back to the nephrologist again. So this is done now. You go for the renal tumor removal. Then that nephrologist said, no, better go back there. This is his version. And still, this happened about 10 years back. Renal tumor is like that only. He is getting little bit of fever whenever the necrosis cells is happening. Otherwise, he is hale and healthy. Actually, as per the protocol of the modern science, one kidney gets the renal tumor, cancer. The other kidney will get within a span of 10 years. But touch wood, he never got anything. He has taken simple remedies like Indukantagrita, that kind of medicine. And one more thing I'd like to point out here, probably some of the treatment we will see. So we have to treat something like this, a simple Koshtagata Vata Chikitsa. Koshtagata Vata is what we have to do. Koshtagate Vate Nigraho, Mutra Varchaso, Badna, Hridroga, Gulma, Arsha, Parshashulam cha Marute. Gulma, Hridroga, these kinds of diseases are going to come, including Hridroga. Why I point out Hridroga is, if you see the Ashtanga Hridaya, Hridroga Nidana is Gulma Nidana only. Whatever the Nidana mentioned for the Gulma, same is for the Hridroga. That means Hridaya, Gulma management and Hridroga management, Nidana Parivarjana is same. So this is the way, it's very good for the cardiovascular disease to understand and treat. If you know well versed with the Gulma Nidana and Gulma Chikitsa, you can manage the Hridroga Chikitsa also. So hence, Koshtagata Vata, Ksharam Pibenara or Kshiram Pibenara is there. If you feel Kapha Vata is there, go ahead with the Kshara. Shuddha Vata is there, go ahead with the Kshira. They respond better. They can give Grita like Kashayas, if you need Amapachara is there, Indukanta Grita. Indukanta, Kashaya and Grita is mentioned for the Nimnondattajvara, Gulma, these kinds of disease. Vatamaya, Gulma kind of condition. Drakshadi in case of Pittaja like pancreatitis, you can give it. Varanadi in case of most of the endocrine tumor or the to be treated like a Vataja Gulma. Enteric tumors, endocrine tumors to be treated like a Vata Gulma. My high inspiration for Gulma Chikitsa and Hridroga Chikitsa is Professor Rajgopalan from Kerala, Kollam. He is a modern doctor, come Ayurvedic graduate. He did a lot of things, research on these areas. Then Kamaduga Mukta, they can go ahead with the Mrudu Shodhana and Basti line of management. So now I am going to take about the next one is about the Hridroga and related other issues. One I brought it, interstitial lung fibrosis. It causes pulmonary hypertension. So here, now post-COVID, these cases are very common. So ground glass obesity, if you see a lot of interstitial tissues, lung fibrosis happening. In these conditions also, we have to give a Rasayana Chikitsa, go ahead with. Recently, one patient came with this pulmonary hypertension. She was weighing about 94 kgs, everywhere bluish. She can't live without oxygen and intensive cough, very intensive cough. So, with this cough and ascites developed, intensive pedal edema, everywhere bluish colorations, they don't know what to do. Ascites also there. So, what we did, Kshira diet. We have put her on IB pill, Ichabedurasa. Every day you take half tablet, only beyond milk. I first convinced her of 2 days. Then I said, in case of need, I'll extend to 7 days. Within a 7 days time, she lost about 10 kgs of weight. And pedal edema gone, cough gone. Cough was there for more than 2 years. She was dependent upon oxygen. Still oxygen dependency is there, but her cough was gone. She got much relief about her things. And 10 kg loss. And I told, whenever you develop pedal edema, ascites kind of symptoms, you take IB pill, 1 tablet beyond milk diet. This is how they respond very well to these kinds of therapies. Then about the right atrial myxoma. This is another case, interesting case. Incidentally, I came to know one case. She was having intensive eczema in her lower limb, both limbs, everywhere body, but especially in the lower limbs, with a lymphatic fluids coming out. Lymph is coming out like anything. And we thought of doing some Panchavalakara, local wash and do some therapy. But she said, I recommended her to do it at home. When she said, whenever I do it, I get very chill and I getting a kind of syncope. Then I wondered, let me do it in the clinic only. I brought her. I told her you do it here. I told technicians. Then when she was doing, she went for a coma kind of thing. Then immediately they called me, I saw. Then I told that patient, we recovered immediately by giving Draksha Dikasha, she recovered. But I told her, go for an angiogram. Go for echocardiogram. Go for an echocardiogram. So the echocardiogram, when he was usually cardiologist, see who has recommended this echocardiogram. So he had nothing may be there. He did it everything, nothing is there, no problem. Then somehow about to remove he saw something. Then he called his father. He's about nearing 75, 80 years. They saw everything. Something was happening in the right atrium. Some small tumor is there. So then he underwent all the protocols, other protocol. He underwent surgery, everything. And this was removed from her right atrium. So how did it happen? How I came to know about this? This is the symptoms mentioned in Charaka, Trimarmiya chapter. Vaivarnya murcha jvarakasa hikkaha. Trisha pramoha, chardi kafotleshij rujaha, rudroga lakshana. First symptoms, Vaivarnya murcha. With this, see, imagine, probably Charaka mentioned the cardiac tumors. In the Khyanta Shirishi itself, when the Tridosha Dechu Hrudrege, Ye Duratmana Nishevate, Tilakshira Gudadini, Grantis Taiva Upajayate, Marmeka Desha Sankritdehe, like these symptoms. So he has mentioned, he has not seen, probably he has visualized, these kind of diseases are going to come. Cardiac tumor I can see. That's why I wonder, he could understand inside abscess is happening, inside different kinds of tumors are happening inside the body by their yoga vidya. Probably we are very far behind that kind of knowledge. We don't have it. One Lakshana has to. That's why this present day diagnosis will help us to know this disease. Then she underwent this surgery, and meantime they want to put her on the anticoagulant. Now the question came, anticoagulant, because she also had a fibroid issue and intense bleeding used to happen, and her hemoglobin is also down. They are doubtful whether to give it or not. Then bleeding more happens. And they say, let us put some hormone therapy, but hormone therapy once again causes coagulations. So they are in between. Then I said, don't worry. They want to put her on azithromycin and put her on anti-hormonal therapy, observe it. But I said, don't worry, we will manage further. She is fine. Almost now 7-8 years done. She is fine with it. The cycles also became normal. Now she is attained the menopause also. Another case recently has come is ascending aortic aneurysm with atrial regurgitations. So these two conditions, they said 50-50 chances. If you do surgery, you may recover or not. So her problem is lower limb is very painful, not able to walk, exertional dyspnea, headache, no sleep, lost weight. So we treated like a gulma, vata gulma treatment, like Indukanta, Grita, Drakshadi Kashaya, like that. She started responding well. Her BP was something like 200 by 90, 100 like that. Now BP also starting coming back to normalcy. So here also choices are like this, depending upon the need. You can tumor, if it's there, go for the Avranadi Kashaya. And in case of Vataja, you can go ahead with the Dadimadi Hridroga. If you Vataja type of Hridroga, you can go ahead with Dadimadi Grita. Brahma Rasayana, mainly helpful, most of the cardiac, Vataja type of cardiac diseases. And some of the Leha in case of nourishing Lehas if it is required. Now coming to now I'm going in a way how Charaka has mentioned, first 8 chapter. Now the Prameha comes. After the Gulma, Prameha comes. Prameha related degeneration we will see. Majorly in Prameha Samprapti, he says, Bahudrava Sleshma Vishesha. Abhaddha Mamsa Medaha. We have to see Abhaddha Mamsa Meda at the cellular level. Abhaddhata of Meda Mamsa is there at the cellular level. Then if you understand that kind of degenerations, then our present day diagnosis will completely alter. Prameha Pratyatma Lakshana, especially the Madhumeha Pratyatma Lakshana or Prameha Pratyatma Lakshana, Bahumutrata should be there. Prabhuta Mutrata and Avila Mutrata should be there. Present day diagnosis 95% is not based on that. It is based on the blood sugar, HbA1c, that kind of test. So this is not at all fit for the concept of Ayurveda. What you have to diagnose, the Pratyatma Lakshana, if there, what is that disease? It's something else. It's just Dhatu Prakopa or Dhatu Vruddhi Lakshanas. This can't be considered as that disease. So that's why diabetic is India is a number 1 in diabetic population. I completely disagree with whoever patient comes to us. Prabhuta Mutrata is there, Avila Mutrata is there, then I'll consider as a Prameha or other Meha. Otherwise, never consider it and treat accordingly. I have a patient with 300 blood sugar, postprandial 400, more than 20 years, they are hale and healthy. I am very confident that if any symptoms is there, you manage the symptoms, understand the disease, what it is, rather than simply going around the laboratory test. So this is also one concept. And so another disease is fatty liver. Fatty liver is one of the precursors for the diabetes mellitus, they say. So non-alcoholic fatty liver is the issue. So I consider it is not non-alcoholic fatty liver, it's also alcoholic fatty liver. Why? Because present day, especially in Bangalore kind of things, people have a dinner at around more than 9:30, 10. Some practitioners also will have 10, 10:30. So Charaka says, if it's just nothing but going to cause annavisha. Apachyamanam shuktatvam yatyannam visharupataha. Shuktatva is a fermenting process. The fermenting process, automatically liver has to do the function. Slowly liver degeneration starts, fatty liver starts. So hence, I won't consider as a non-alcoholic fatty liver, I consider as an alcoholic fatty liver only because self-generated alcohol. This is a self-generated alcohol, is going to cause a problem. We can reverse it easily by once again, if Gulma Chikitsa, you can do it, you can respond well to the, for example, Mamejava Ganavati or some of the Pittarechikakvata, Patalakatrinatkata or Varanadikasha, they respond well. Diabetic retinopathy, the major vital organs are going to be affected because Prameha, what he says, Tridoshakopanimittaha Vimshati Prameha Bhavanti. Vikaransha Aparisankhya. Innumerable complications are going to come because of the Prameha. Many complications, Indriya related complications are like this. Here we can go ahead with the different kinds of procedure like Shodhana and Dara. It helps a lot. And another one is diabetic neuropathy. Here also the management, improve good circulation, do some Shalis Veda or something like that. They respond. So overall therapy you can give. If Prameha Lakshanas are there, you can go ahead with the Prameha Chikitsa. If not, according symptomatically, you can manage by giving the medications and Snehana, Svedana and Virechana process. Next comes to the cardiovascular, vascular related. Long back I had one patient with a carotid artery block. Carotid artery block, more than, it's internal carotid artery block, more than about 3 to 4 inch block. And this patient complaint was headache. All 24 hours, no sleep, headache only. And because of that headache, he was, none of the painkiller was working, that much intensive headache. And he's a smoker. And what happened was, the steroid is reducing the intensity of headache, but it has been contraindicated in the clot. So they recommended, we will wait and see. They gave some medication, nothing was working. He underwent our classical therapies. So it took a lot of time, but at the end we got a result and his carotid artery block cleared. Once again they did the angio and it showed no clot was there. So here what you have to understand, second, after some time he again resumed his smoking habits. He got deep vein thrombosis. Now once again he rushed to the hospital. There they said deep vein thrombosis is there. You have to, cellulitis is there, you have to get operated. Then he said, no, take me to the Dr. Murulidhara itself. He treated this only, now we can manage this. He said like that. Then they said, no, this may be kakataliya, we will do the test. They did the angiogram. For that purpose they did the angiogram. CT angio that showed clarity. There is no blockages was there. So this is how we need the technology to support before treatment and after treatment. If you do it, then we can show the research is necessity in that area, especially for us to diagnose the disease and later the management. Otherwise, I would have treated in a different way. Probably I did not know. We came with a report, we could understand. Another case came to me about a couple of years back. This girl she came to me when she was about 18 or so with pilonodal sinus. Not at all healing, somebody referred. When I was inquiring that case, I came to know that at the age of 13, she had very intensive headache. She used to get headache frequently and she used to visit doctor, they give symptomatic remedy, and one day she fell unconscious at the age of 13. Then she rushed to the higher hospital. There they checked everything. Blood pressure was very high. Blood pressure was very high, something like 200. They started putting on antihypertensive medications, and then they observed diagnosis. There is a renal artery stenosis was there. One kidney has shrunk. You can see a black color there. One renal artery blockages was there. So they did the angioplasty there. A stent was placed. Then she was fine, taking antihypertensive medication. Within a span of 6 months, she started getting headache again. BP also started going high. Once again they did CT angio. Now other kidney got affected and internal carotid also got blocked this time. So once again 2 stent placement was done, and then when she came to me, she was on immunosuppressant MMF, 2 antihypertensive drugs, and also having a problem with this pilonodal sinus and difficulty to walk for a short distance. So at that time, because pilonodal, I was medical management, I was finding difficult. I referred to a Sushrutha specialist. He said she was also on blood thinner. I need opinion from physician to withdraw the blood thinner. I can do the procedure. Then she went again to the doctors. When they did the further checkup, they observed that the aortic, descending aorta getting blocked again. Descending aorta, no blood flow was there. So that's why she is not able to walk for a short distance. So now we thought better not to. They saw everything, then they decided we will sit together and discuss because we are not finding anything. We will give some time, continued the antihypertensive drugs and the immunosuppressant, ecosprin. Then they said better wait for surgery. Then I said we will do therapy. We did the Virechana followed by Basti procedure. We reduced antihypertensive drugs, immunosuppressant we stopped, and ecosprin also stopped. Then I referred to the Sushrutha specialist. He did that also. Now she completed engineering. She recently married. Before marriage she once again underwent the cleansing, and now she is having 1 child. So this decreases the blood flow to her uterus also. This also, cycles also very minimal bleeding was there. So they are apprehensive whether to get married or not. That was the questions. So I said before having child you can have it, but their parent side, the husband side, they are not very for it, but still she could have a normal child. So like this, one of the rare disease I got. This is about the moyo. Recently I was sharing with Dr. Shailaja also. I was discussing with one doctor. He is also my patient. He is a cardiologist cum neurologist, both specialist in both science, but he takes Ayurvedic treatments. So for his neurological problem, he comes for Ayurveda. He is a neurologist. So he's referred one case, a Moyo case is that this patient is from Chennai, but they are now in Holland. So twins are there, they are having a problem. This is Moyo. This is a blood flow to the brain reduces. The child, both are having seizures, intense headache, giddiness, sometimes stroke kind of ischemic conditions. This is their symptoms. So we did simple because they are still 13-year-old, not fit for Shodhana. What we did is simple, we did a Dara procedure. With that, their headache gone, overall the sensory organ and motor organ functions improved, and their blood thinner, everything we have reduced. Their overall well-being has restored. So that's why these kinds of conditions, to improve the blood flow, you can give Mahamanjishtadi Kashaya or Vasha Gudishchadi Kashaya, that kind of drugs. Gugulu prepare. You can simply manage like something like Vatarakta line of treatment. This disease is called as middle aortic syndrome. This is middle aortic syndrome, very rare disease. Then we will go to the next session. So this is a very common case nowadays because the post-COVID disease, avascular necrosis is very common. Here also we can manage like a Vatarakta line of management, they respond better. And this especially ligament tear and all, third degree, also we can do well with our therapeutic approaches. And osteoarthritis, these are all some of the diseases we can manage. This degeneration is easy. And all these, except probably the last one, if it is too much, otherwise including herniated disc also, we can manage well with our line of management. So the therapies are like this. You can give, in case of Avarana is there, you can give Ama is there, you can go ahead with the Rasnerandadi, that kind of Kashayas. Then you can nourishing therapy like Narana Taila, all those. For example, these kinds of ligament tear, you can go ahead with the Matra Bhakti with Gandha Taila also, or internally also you can give some Gandha Taila Shamana form. And Stanika Bastis, Abhyanga, Patrapinda, these therapies will be help a lot. So another one is the multiple sclerosis kind of things, very common nowadays. We get a lot of cases. Here also we can do wonders by giving the medications like our therapies and nourishing therapy. And also some of the cerebral related diseases like ataxia, gliomas. So one case I remember probably when I was in Bangalore Institute of Ayurveda and Integrative Medicines as an in-charge principal there. One case came with an intensive headache. ENT Shalakya department and Dr. Suresh was there. He is now in Europe. So that doctor was telling, I have a case of this headache, none is responding. She is not ready for any investigation also. I said, you better do the investigations, then we will do our way of treatment, no need of any surgical intervention. So at that time, they underwent for a test, they identified it is a healed tuberculosis there, that was the cause for her headache. So then I said, we will go ahead with the Shodhana, we start with Snehapana. By doing Snehapana itself, her pain has disappeared. Simple, complicated case, but with Snehapana, pain has relieved. Headache, she was not having sleepless night for so many days. So by simple Snehana Chikitsa, they started responding. Then she, after 3rd days or 4th days, I am fine, why I need treatment? She said, no, this is the protocol, it may appear again. You undergo the classical therapy. Then she underwent Nasya also, she recovered well. Like many of the post-surgical glioma also, we have to do our line of management. I had a couple of cases together almost in a month time. One case after the glioma surgery, she underwent for our line of management. The other lady underwent chemotherapy radiations. She could survive only for about 1 or 2 years. This lady, almost more than 13, 14 years past, still doing fine. So this is our way, the glioma, all these cerebral, the neurological tumors can be controlled well. In the beginning, recent I got one case, he was responding well to the medicines. After 2 years of this, after post-COVID, he stopped taking the medicine for glioma. Like we used to give some Shivagulika, that kind of medication, and also he was under pranayama and strict exercise and diet. He was responding good. When he stopped the medication, once again he could develop the symptoms of epileptic seizures and all. Then he underwent chemotherapy, radiations. Still it is growing. Then they thought, once again come back. Now he is underwent already Virachana. Now the recent scan shows his tumor size is reducing. That is the effect of our therapies. So many of these cerebral other degenerative diseases also, in the initial phase they come Because I said earlier, the first is Gulma. If you go further, then one by one disease like Atisnehana leads to Prameha, then later diseases like the Yakshma kind of disease or the disease like Togrogas, then comes the Unmada Pasmara. So we have to handle, in the beginning itself, Jara has to be managed properly, we have to do Jarante Virechana, that kind of program, at least they have to take care of proper diet and regime, so that Punaravartaka Jara or Jara related symptoms should not persist. Because Lina Dosha creates a lot of problem. I was just sharing with Dr. Alok, I had once one case of snake bite, when the initial phase of in Purnai practice, Dr. Anish was there. So one lady complained of burning sensation all over the body and also sleepless nights for so many years. Then the treatment was given, none of the sleep medicines working for her because almost 30 years passed. Now, after looking at that case, Dr. Anish said, we will go ahead with the Visharasana Chikitsa, Visha Chikitsa. He did Visha Chikitsa, patient started feeling better day by day, recovered completely. Such a wonderful, simple medicine, Visha Chikitsa is helping. Recently, I was hearing one webinar by Dr. Rajgopalan from Kottakal. So, one of the Pakshagata patient they were treating, it's not at all responding. Then they saw, in the history, they saw the snake bite. Then they started taking Visha Chikitsa. Then the patient started responding. So, the diagnosis and prior histories are very important. Lina dosha in Jara also, for example, viral fever. We say viral fever. Who has invented that virus word? It is nothing but Sanskrit, virus. Virus is Vigatarasa. Vigatarasa means Visha only. Visha has the property of all Vojoksha Lakshana. You have to treat Vojo Ardhaka Chikitsa. So like this, the Lina dosha management, all these viral, most of these multiple sclerosis are disease related to the frequently getting sickness is because of they have a Lina dosha. You have to handle with Mrudu Shodhanas or in case of need other therapies like Basti, they respond good. So whatever therapies which I have mentioned here, so especially this Kalyanaka Grita also in dementia conditions, Kalyanaka Gritas and Kalyanava Churnas will help a lot, bringing back their memories. So in our science it's a geriatric care is, geriatric word once again derived out of Jara. Jara, if you see, Jeri, that is the word, it's originated. So it is majorly helpful to prevent Akalaja Jara and bringing back the normal Jara. And Rasayana, as you know, it is helpful for the, especially in the present day practice, it's an antioxidant, immunomodulatory, adaptogenic, anabolic, in a anti-aging also. So point to ponder on Basti Chikitsa. I was with last slide. I'll list probably few more slides are there. This is very important, my interest of topic. This is for the, especially for the those who would like to research. I saw this one image, monument in Russian city, one village. They have kept in their health center. This is a enema syringe. They are kept as a monument. It is about 365 kilogram of bronze metal. Bronze metal. You can browse in the internet, you can get it. So this is indicative how Basti is important for the therapy. This most of the Middle East and all the other European countries, they do, especially in the Middle East, they do first aid. I had one patient, he is a pediatrician, worked in the UAE. He told that first line of treatment for any mother is they give enema at home. Simple syringe they give. If not responding, they will come to us. This is the way they tackle. Still it is, those things are there in their memory. Traditional practice, they kept under their things. This is very wonderful. We have to think about once again reinventing these kinds of therapies. Especially the Madanaphala. Most of the Yapana Basti, Charaka says, Ashto Madanaphala. Ashto Madanaphala. What Madanaphala does, one, if you intake, it's intensive vomiting. But if you give Ashto Madanaphala in Basti, how it will be? It's impossible to take that kind of Basti if it's Shuddha Madanaphala is there. Very strong purgative. Patient, one patient, he said, I am holding, because you say it's so wonderful, you are putting so much of medicine, take time to prepare this Basti. I said it will be having only few minutes, it will retain, it won't stay. He wanted to put it, hold that. Then he started getting a smell of honey in his mouth. This is what it is. So it can bring the doshas from all over the body, especially from the circulatory system, brain, deep-seated diseases like Sandhyasti Marmaha. This disease is related to the cirrhosis, Madhyama Roga Margashrita Vyadhi. So to bring those doshas from there and rejuvenate that area, Madanaphala play a major role. This scientific study has to be done, how Madanaphala Krita Bastis are helpful in, and moreover that the Basti itself. If you say, I'll go to the next slide. So this is about the gut microbes. So if you take any probiotic through oral, the gastric enzymes are there, they'll destruct that probiotic, prebiotic, probiotic, everything is gone. It won't act, it can't strengthen the gut mucosa. So the gut has many role to play in our cognitive functions, brain functions. Hence, we have to have good toning up of our gut and strengthening of gut. This basti may helpful because the honey is also a prebiotic, and we give takra basti, chira basti. These are a lot of the gut microbiota strengthening things which will be helpful to nourish our body, get rid of the most of the marmasita vikara also. I still remember once when I was a teacher, Reddy was there, Dr. Ishwar Reddy was there. So he has for intervertebral disc prolapse, he has given 30 days of basti, patient not having any symptoms. He has done kati basti, 30 days of karma basti, patient is said, how is he? Oh, fine, no much change. But after 1 month he comes, no problem at all. He so much of recovered. Probably the gut microbiota has helped him recover later. First, sometimes patient recover fast. Another patient I saw, we did virechana for one Pakshagata patient, not at all responding. So after the Anuvasana, second day Nirobasti, we are asking him, how are you? Then immediately after one Nirobasti, he went and came out, how are you? He is not able to talk, he is lifting his hand. So such a powerful, one Nirobasti has such an effect in relieving the symptoms. So to maintain health, we also have to have a different kinds of sadvritas, and we have to have a complete understanding of the reality so that our Di, Dhriti, Smriti will be proper. So that we have a clarity, we can give a clarity to others. So that's, we have to inculcate to the patient also to have these kinds of things about the maintenance of health. Also, always give it to importance to for the patient is self-health assessment. Don't go for too much of laboratory investigations. Every 6 months, 1 year, they come with a report. If HbA1c 8, they'll come to the clinic. In this NIH, in UK and all, 8 HbA1c, no need to visit the hospital. You have to visit only once a year. Here, once in 15 days also they do come HbA1c, come and show it to us. This is not required. That much of test is not required. Unnecessary medication is also not required. You have to have a self-health assessment at the sensory level, neural level, psychological level, as well as your physical level, whether we have a proper bowel movement or not, whether appetite is there or not, sleep is good or not. These things has to be observed. And to conclude, early interventions, so sometimes diagnosis will be helpful. Our therapies also helps a lot. Unnecessary medication, I won't recommend for a patient to take anti-hypertensive drug or anti-cholesterol drug or blood thinner for a long time. My patient, they comes, I'll withdraw, I'll give something else, not for that medication for a long time. Because that also causes kshaya, degenerations. So these are all kshara-based medications. You have to understand the kshara-based should not be given for a long time. Give something rasayana rather than giving these kinds of medication for a long time. I never recommend. Those interested, they only come, I don't mind. So this is my policy. I say, if you are ready to quit medicine, I am going to have a treatment. And also we have to do a lot of assessment. And for the progress of these kinds of things, we have to do combined effort like the previous work, what they have done. Wonderful job. We need post also assessment so that it is helpful to overcome or prevent these kinds of degeneration. Thank you so much for your patience listening. Thank you so much for giving me an opportunity to talk. Also, anything is there, sir, you know me. Any guidance, I'll accept, sir. Okay, thank you. Thank you, madam. Off ಮಾಡಬೇಕು.
Thank you so much, sir, for the wonderful session. Now the session is open for Q&A session. Any delegates or teachers, please to ask questions regarding the session.
Namaste, sir.
Namaste. Yeah.
Thank you for a very stimulating and assuring presentation. I wanted to know how to approach intolerances. Nowadays, we see that the ahara itself, the diet is becoming intolerable for people, like milk intolerance, lactose intolerance, and all these things. Of course, in India, we don't have much of these issues, thankfully. But we see that people who are migrating from India to other countries, or even in other countries as well, the people who are residing in those desha also are getting these issues a lot. This is just an example, but then slowly we are even finding intolerances for grains or vegetables, etc. So what is your approach? I know it is not exactly the topic, but...
Right, this is related to topic only because, So this is a very important subject. People think that earlier they used to take milk, now they wanted to avoid milk. So first thing what we have to see, whether really intolerance is there or not. For example, in the childhood itself, they make a practice, child has to drink milk. That's the concept. Sometimes they give 3 times milk. Well, child has a aversion to milk. They start giving mix with the Complan or Bornavita or something, they add apang, upang, mix it, drink it. They have a slogan also. Meow, मैं कुत्ती है क्या? मैं बिल्ली है क्या? दूध पीने के लिए. Then they mix this drama mixing with the Complan or something, then child will drink the milk. The first one was aversion to milk. Probably if they are kapha dominant, they avert milk. They don't like taking milk. So now they are giving milk. This probably create later the intolerance to milk, further kapha related disease will come up. The present day, especially in the abroad, lot of the hormones have been injected into the grains also, especially in the animal products. So especially for the cow's milk, they do that, hormonal therapy. So to increase the cow's milk production, that's why they become very sensitive to milk. Otherwise, the grain also sometimes genetically modified. For example, gluten intolerance, we can see. Earlier, this was not there. So to increase the fat and protein content of the wheat, they have modified, genetically modified. That kind of grain is a problem. If you take jave godi, probably it won't have such a bad effect. So nuts, seeds, everything. What we have to focus here, once again, being a Kayachikas, I say Agni, otherwise also Agni only. Recently I had one patient with a high level of homocysteine level, and he had a sagittal sinus, transverse sinus thrombus is there, very intensive headache was there, he went for unconsciousness. When we checked for his homocysteine level, it's a kind of protein, it was more than 90, normally it should be about 14 or 15, it was 90. So we give anti-allergy therapy, some Haridra Khanda, with that he recovered completely, that block also cleared after the CT, once again angio. So what we have to see the level of IgE, whether they are really sensitive to that, and we have to strengthen their Agni. When Agni is strengthened, none will have a problem. Unless and until really they are sensitive, it will be sensitive from the childhood. Later, some problem with their Agni only. We have to see the Tatugni level or the Koshtagni level. Okay. Okay then, thank you so much. Thank you.
Thank you, sir. Any further queries or questions? Now I request chairpersons to give their insights and inputs about the session.
Good afternoon to all. Om Shri Manjunathaya Namaha. Om Shri Dhanvantare Namaha. Respected chairperson and presenter of the today, Dr. Murulidhara, Dr. Madhav Digavi. This combination is actually Dr. Murulidhara and me. We were working together in SDM Hassan long back in 1996-97 and still back in 90s. So Dr. Madhav Digavi was my junior there in Hubli, AME Hubli. So this combination is very nice, having a presenter Dr. Murulidhara Pangala and along with me Dr. Madhav Digavi here. And topic is also very nice one and it is related to me also. Neurodegenerative disorders. We observe a lot of neurodegenerative disorders even in pediatric age group also. I am from the Department of Kaumara. We treat a lot of neurodegenerative disorders. Prevention of neurodegenerative disorders is very much important. While explaining the question, Murulidhara was answering, it should be from the childhood. Agni, protection of Agni. The same thing I was thinking about the question. Concept of Satmya and concept of Hita. If we follow properly and if we take care of the Agni properly, definitely we can have solution for such all problems. And I was also thinking that AMA and autoimmune disorders are the result of such whatever asatmi ahara which is consumed since the childhood. That is why mainly giving importance since the beginning while starting from weaning, during weaning nowadays before 6 months only the weaning is adopted. That is also one of the, and many a time the parents wants their kids to be with, rather than healthy, they want a obese child. Start with this badam and all and not properly following the weaning, proper weaning. One should be, one with the single grain it should be started. Siridhanyas are the best, mainly ragi needs to be started. If such a proper weaning and follow-up of the Agni and follow-up of the proper Hitahara and Satmyahara, the chances of autoimmune disorders and also this whatever she asked, such problems will be get minimized. And one more thing I was thinking, Bijatma Karma Shaya Kala Dusti, Matustatahara Vihara Dusti, Kurvanti Doshani Vividani Dusta, Samsthana Varnaindriya Vaikratani. All degenerative disorders, their origin, Bija, Atmakarma, Kala, Ashaya, Matustatahara Vihara. These all things, if we take care properly, then childhood neurodegenerative disorders and future neurodegenerative disorders also may be prevented or minimized. So, as Murulidhara was telling different cases, I was also explaining different cases. I was also getting many patients of me, their management. One case as Gulma management. Recently, 1 year back, 1.5 years back, a girl named Revati, with such Gulma presentation only. Her age was around 9 years and she was with such problems, all Gulma presentation of almost 1 year and which was not treated means she was not getting improvement, and she was not able to sleep in the night, and she was with the psychological issues and all. With that, mother brought her to hospital, and she stayed in hospital, IPD, for more than 20 days, 25 days or something. I was discharging her, but mother was not ready to take also. So mother was telling complete recovery. So she had a complete recovery, and now it's almost 1.5 years. Now she is very nicely keeping up, and the scholastic activity, everything is good now, and she is not having any that gulma presentation, and also psychological disturbance what she had, and because of which we got many more patients by mother's what you can one-to-one, mouth-to-mouth publicity also. And I was also remembering one more case recently, I think yesterday or day before yesterday, he got discharged. Wilson's disease. That child had a copper deposition in liver, and he was treated in our hospital with the Shodhana therapy. For Revati also Shodhana therapy, Virechana and Bastis we are given. And for this child also, one who is with Wilson's disease, and it was before Corona, and he was improved a lot. And after Corona, since last 4-5 years, maybe 3 years or something, he didn't back to us. But last week he came to us. Today he is going to get discharged. And now he had even neurological symptoms also. That time he had only hepatic dysfunctions and all. Now he is with the neurodegenerative issues also, paralysis and also speech disturbance. With 1 week treatment, we did Basti this time to him. With 1 week treatment, very good changes we are observing now in him. And one more patient, Dikshit, he is also getting discharged today. He had tumor in brain, and which was treated 3 years back, and he is with the seizure. Before also he had seizure, and after surgery, 2 or 3 years back he had surgery. For few months he didn't had seizure. Once again seizure started, and recently he had severe seizure, which made him to once again bring back to the institution. And after giving treatment of 10 days, now yesterday only, last 4-5 days, yesterday only he had 1 seizure. Continuous seizure was there. He underwent once again Basti this time, because repeated Virechana patients sometimes they relent, mainly pediatric patients. And also 1 tablet, I am not remembering the name of that, from Koppala, our Dr. Nayan brought that tablet, and we did Anjana with that tablet, and now he recovered almost. Miss, no, I cannot say that once again after going back. Now he was advised for once again surgery, but they don't want to go for surgery. Such all cases, neurodegenerative disorders, our Shodhana therapy helps a lot. And now itself I got a call from mother of one girl, one who is having Angelman syndrome. So in Angelman syndrome, once again, it is also neurogenetic and neurodegenerative disorder, where the child is associated with seizures and once again speech disturbance. And that girl also with the treatment, since the age of 2 years she is coming for the treatment. Now she is of 9 years, and that itself says that since last 7 years she is with us, getting good improvement, because in that condition we cannot have cure, but only we can help them to have better life. And one more also I was remembering, Kawasaki. So Kawasaki, the baby was with at 1 year, 8 months or something, and that was followed by Bell's palsy, and we treated him once again as sir told. With the treatment of 10 days or something, baby recovered completely, but it was a Kawasaki Visha, virus Visha. So that is why we followed up him followed up for another 2 years, and now the child is nicely, means he is now not having any complaint, and he is going to school also. So such all many neurodegenerative disorders we observe, and cerebral palsy. And one more thing I was remembering, as Murulidhara was telling, the role of Madanaphala in Basti. Recently we had one dissertation work on cerebral palsy with the Ardhamatrika Basti, where one ingredient is Madanaphala with the Chaturbhadra Kalpa Basti. That also given a very good improvement in kids with the cerebral palsy. So once again I congratulate Dr. Murulidhara for his nice presentation on degenerative disorders and neurodegenerative disorders. Thank you for the opportunity, Sushrutha Avabodhini and Sushrutha College and this S.Vyasa University, all the management members of S.Vyasa University. Thank you.
I request Dr. Madhavi Digvi sir to further give the views.
Good afternoon, ladies and gentlemen, respected chairperson madam, and the speaker of this session, Dr. Pangala Murulidhara Bhat, respected P.N. Rao sir, the principal of Sushrutha Ayurveda College, all the staff and PGs and internees and students. At an outstretch, I will not take much time. At an outstretch, I am thankful to Sushrutha Ayurveda Medical College and S.Vyasa University for giving me an opportunity to chair this session. I am also thankful to Dr. B.R. Ramakrishna sir and Nagendra ji. It was a wonderful session by Dr. Murulidhara Bhat. The scope for invasive techniques in degenerative disorders and their management. Actually, the style and flow of Dr. Murulidhara Bhat, first time I heard him, it was very easy and easily communicating, and he was flawlessly giving the clinical examples. So clinical trial based or case study based explanation was very good, and he has covered most of the systems in the body except my department. He has not touched the Vajikarana. Mostly I should tell, that's why Murulidhara has told in short. But he was really convincing for various degenerative conditions, and hope GI tract is a major area for general practice. That's why he has quoted more of the examples from Pachana Samsthana and Grahani, Gulma. He has quoted very well. Radio frequency is a new concept of treating the invasive problems and degenerative disorders. Continuous use of radio frequency waves is also one of the area to reverse the degenerative disease. Of course, doctor has clarified, degeneration in Ayurveda is Dhatukshaya. Dhatukshaya leads to Vata Prakopa, and Vata Prakopa treatment is Basti. That's why his entire line of treatment, if you see, Matra Basti, Snehana, Svedana, was very well highlighted, and it is principle based clinical practice. We call it as principle based clinical practice, he has quoted. And Dhatukshaya causes Vata Prakopa. So Vayus Tantra Yantradaraha, the engineering department of the human body is controlled, structured, modulated, maintained, governed by Vata Dosha. That's why, and many times he has quoted some critical cases. So the critical case management is also due to Vata. Indriyanam manonataha manonatastu marutaha. The all sensory motor system of the body or sensory motor orchestra of the human being is controlled by mind. And the mind, intellect are controlled by hypothalamo-pituitary axis or limbic system. And that limbic system is once again governed by Vata dosha only. So Vayu is Sarva Shariraga. So the structural and functional integrity of the body is damaged by Vata dosha dushti. That's why I think the organizers of Avabodhini has done a technical session play. In the morning, Ratna Prabha madam has given a proper explanation of neurophysiological basis for understanding the neurodegenerative diseases. and the second session is understanding the degenerative disease and their management and their diagnosis. For example, arthroscopy is an invasive technique to understand the degenerative disease in the joint. And minimally invasive lumbar puncture is also one of the invasive technique to understand the degenerative changes. Sometimes a CT guided or MRI guided angiography, minimally induced, some dyes are induced, that is also going to give a picture of cerebral atrophy or cerebellar degeneration and also some of the neurodegenerative changes in the brain. In such cases, actually speaking, the route of samprapti, making a planning for samprapti of that individual is very important. So sometimes we are having Lakshana based understanding. Ayurveda is more oriented about Lakshana based diagnosis of a patient, Hetu based diagnosis of a patient. Modern people go behind samprapti of a patient, and microscopic or microbiological or structural tissue culture leveled understanding of the pathogenesis, ongoing pathology, they go behind that. That's why they use more of the invasive techniques, where Taila Bindu Pariksha or Shuddha Rakta Pariksha, Artava Pariksha, Shukra Pariksha, all these are explained in Ayurveda, but they go in and around Dosha Dhatu Mala Moolammi Shariram. So the toxins, endotoxins, tumor endotoxins or any other microcellular toxins are called haptens. Even haptens are also going to cause degenerative changes in the past, in the future. So firstly the infection, inflammation, then comes is necrosis, fibrosis, then comes is oncogenesis. I have seen one beautiful correlation between the cancer and degeneration. You can see some of the patient come with sudden presentation of Dhatukshaya and Ojakshaya, and they will present a temporary phase of tuberculosis. So tuberculosis is an infection, you start modern anti-tubercular regime, patient will not improve. After the period of temporary tubercular infection, patient shows tumor markers positive. CA 19.9 and CA 125 will become positive after a course of tuberculosis diagnosis. So, a transient tuberculosis is one of the Purva Rupa for incoming cancer. So, cancer causes so many degenerative changes in the body, in the concerned cell or in the concerned organ or system. In diabetes, we can see that when the insulin molecule is unable to enter the cell, the diabetes is an issue. If we are able to push the insulin molecule inside the cell, that our work is over. So calcium is important ion needed for pushing the insulin molecule inside the cell. So that's why most of the secret medicines used in some of the Andhra Karnataka border is Sunna Kalpas. Rasashastra stops at Bhasma and Sindhura Kalpa, or even in they stop at Gandhaka processed into Guti Kalpas. But some of the Siddha people convert Bhasma into Chunna or Sunna Kalpa. They are very powerful calcium generated drug which will enter into the calcium channel ions, or it will enter the insulin molecule into the cell. If cell gets insulin, degeneration stops. If cell doesn't get insulin, the Kayasya Antaragneya Chikitsa starts there. If you are unable to push the insulin, the degeneration of the cell or tissue or organ starts. So that's why we are able to see most of the post-COVID complications, post-COVID avascular necrosis or post-COVID cases of many lung degenerative disorders, interstitial lung fibrosis, they are all increasing. Even cerebral atrophy and stroke is very common after interleukin 6 and D-dimer. Nowadays, I am getting D-dimer cases very frequently. Even though COVID-19 is outdated, but post-COVID viral sequelae is causing interleukin rise, D-dimer rise, LDH is rising. These are inflammatory cytokines. If you don't treat inflammatory cytokines and if you don't suppress their activity, they'll end up in degeneration. So degeneration, I have seen that acute kidney injury just next to common cold, cough and fever, CCF, cold, cough, fever will cause acute kidney injury. And recently today our health ministry is in Ballari to see a cascade happened that Sutika Paricharya was in trouble, series of Sutika died in Ballari. It is because of sudden choking due to RL solution was a mistake, it was reported. And there was sudden kidney failure, dialysis was done, and then degenerative disease stopped the blood flow to the kidney and patient died. So, acute degeneration and chronic degeneration are preventable, manageable, treatable by Shodhana and Rasayana Chikitsa. Hence, Shilajitu Rasayana and Bhallatak Rasayana, two important Rasayana are effective in treating degenerative disease. I quote, there is no disease in the world which Shilajitu cannot treat. There is no Kafajavadi which Bhallataka cannot treat. So Shiva Gutika becomes one of the prime Rasayana in our general practice. And one more powerful anti-degenerative drug is Bhallataka Ghritam, Sahasra Bhallataka Ghritam, and in the market one capsule is available, Seren Kottai Nei. It is from Tamil Nadu. One simple capsule comes, if you put 1 BD Seren Kottai Nei, lot of the degenerative disease can be blocked or prevented. Or Anagata Bada Pratishedam of Acharya Sushrutha rightly says that before the onset of degeneration, stop the degenerative sequelae. That can be done by two types of Rasayana. Chakrapani says, Vyadhi Kshamatvam Nama Vyadibala Virodhitvam Vyadhi Utpada Pratibandakatvam Cha. Vyadibala Virodhi Rasayanas are very powerful anti-suppressant Rasayanas. Vyadhi Utpada Pratibandaka Rasayanas are Saumya Kalpas. Like Chavana Prasha, Vyadhi Utpada Pratibandaka Rasayana. They are Saumya Kalpas. They work very softly. They are immunomodulator, immunoenhancers. But in case of cancer, where degeneration is very strong, hypothalamic pituitary gonadal degenerative process has started, testicular degeneration has started, then we should be more focusing on Vyadibala Virodhi Rasayana. Vyadibala Virodhi Rasayana are having more side effects, and Vyadhi Utpada Pratibandaka Rasayanas are having no side effects. Ayurvedic Kramavruddhi Bhallataka Rasayana is there. In Rajasthan, one trend is there, Ashodhita Bhallataka Vardhamana Prayoga is there. Drink 100 ml of Ghruta, followed by that Vardhamana Ashodhita Bhallataka Prayoga. I have taken Ashodhita Bhallataka Prayoga when I was a PG student. I have taken up to 3 Bhallataka up and 3 Bhallataka down, because I am typically Kapha Prakriti. So, and Vardhamana Vatsanabha Prayoga is there in Samhita. Vatsanabha Vardhamana Prayoga, rightly quoted by Murulidhara Bhat sir, where Jara is one of the inflammatory cascade. Jarado Langanam, Jaramadde tu Pachanam, Jarante Beshajam, Jaramukte tu Virechanam. When Jara is over, viral load is going to affect either lungs, thyroid, or kidney, or intestines. So to prevent that, Vyadibala Virodhi Rasayana like Vardhamana Vatsanabha Prayoga. I do Vatsanabha Vardhamana Prayoga in diabetes mellitus, where degeneration of pancreas are there due to pancreatitis. Pancreatitis and post-pancreatitis degeneration can be prevented by Vardhamana Vatsanabha Prayogas, Vardhamana Kuchala Prayogas. In case of avascular necrosis, Vardhamana Eranda Bija Prayogam and Vardhamana Kuchala Prayogam. These are very effective line of Vyadibala Virodhi Rasayanas. So, Avabodhini, a very good name given by organizers, Ava Akarshane Bodhani. It is going to attract the needful research scholars. It is going to attract the right research scholars who will give you the knowledge. The morning, whether it is Ratna Prabha madam or Dr. Murulidhara Bhat or Shailaja madam has contributed rightly from Kaumara Bhritya. Kaumare Acharat Pragnaha Dharman Bhagavataniha. I am very happy to see in the morning one shloka of Bhagavad Gita was rightly explained. Bhagavad Gita is a Achara Rasayana. Bhagavad Gita is a Achara Rasayana going to prevent psychosomatic and psychoneuroimmunoendocrinal crisis. If you rightly understand one shloka of Bhagavad Gita, it is going to give spiritual healing of cell damage. Spiritual healing of cell damage. That's why this is one of the very beautiful environment of 100 acres. I am visiting first time and I am really thrilled to see that this is having spiritual, mental and even nutritional. The morning nutritional diet, I saw it is Satvika food. So Satvika, Rajasika, Tamasika is one of the basic approach for treating our Ayurvedic science of nutraceutics. So in this scenario, our Bodhane, our Akarshane, it has attracted lot of young minds. These young minds will carry this research mentality or research mindset, and this research mindset will go to their respective institutes and they will develop their own protocols. So with this remarks, I am very happy for presentation of Dr. Murulidhara Bhat. Again and again, Avabodhini 2.0, it should go to 20.0. Understand, this torch-bearing phenomena under the torch-bearing headship of Nagendraji and Ramakrishna sir, the Vice Chancellor of this institute or university, should run. This is the right way of integration. Yoga, naturopathy and physiotherapy and spirituality and then nutrition should go hand in hand with Ayurveda. Then only we are going to give some solution to degenerative disorders or cancer-like diseases. In one of my clinical trial with Dr. Padmavati, we were able to dissolve the glioma in the brain. Because of that glioma, there was a stroke. The Pakshagata is of two types. One is Sira and another is Snayu. There are two types of pathologies in Pakshagata, Sira Shoshana Janna Pakshagata and Snayu Shoshana Janna Pakshagata. Snayu Shoshana is due to neurodegeneration, Sira Shoshana is due to thromboembolism. And Vardhamana, Lashuna Rasayana is very effective in both conditions. Lashuna is Shadrasopetam Rasayanam, Mercury is also Shadrasopetam Rasayanam. So, what effect you see in mercury based rasayanas, same rasayana can be seen in Arka and Lashuna. So Arka and Lashuna are very powerful rasayanas. So in that way, the rasayana chikitsa should not be given in the old age. Actually people think that geriatrics, I am by chance I am co-chairman for Rasayana Vajikarana NCSM syllabus making. We are doing a very special attention to Jara Tantra, where when once he is aged, we cannot reverse the age. But aging can be prevented. Akala Jara can be rightly said by sir. It can be prevented. And this should be, Rasayana should be given in Purva Vayasi Madhyeva. Rasayana should be started in Purva Vayas or Madhya Vayas. Purva Vayas is primary education. Madhya Vayas is the PUC education. Actually by 9 years menarche starts. By 29 years there will be eggless female in the world. And people marry after 35 years after PhD. There is no meaning in marrying after menopause. Now menopause age is 29. This is degeneration of ovarian reserve is failed. See, at the age of 9, 100 follicles are there, and at the age of 10 years or 15 years, ovarian follicle degeneration starts. AMH decline in the male, AMH decline in the female. Both are having anti-Mullerian hormone based research we are doing. So serum lithium is one of the powerful area for degeneration. I have more than 120 cases of serum lithium based neurodegenerative disorders. In one of the Ohio University, a neurophysician had interaction with me. Serum lithium is a neurotransmitter which is used in the black box of the flight, the aeroplane. And the same neuromarker is there in the brain. If lithium goes down, the person will get choked with thyroid. And thyroid and lithium choking will cause neuroendocrine degenerative disorders and even further sequelae. That's why lithium is right choice to use in the diet. It is present in the seeds, it is present in the radish, it is present in abracabasma. So abraca is one of the wonderful molecule to enter into the neurodegenerative diseases. It can enter into the spine, it can enter into the brain, and it can stop degeneration than any other drug. Second wonder molecule is rajatavasma. Third wonder molecule is hingulam. Hingula is atirasayanam. There is no drug like hingulam. Hingula is atirasayanam. So abraca, rajata, hingula, ityadi atirasayanas, rightly quoted in the morning session, they have used Manasamitra Vatakam by Kottakal. It contains 52 drugs along with Rajatavasma. Now Rajata 1 kg is 1,10,000 rupees. Very costly metal. So cobalt is also one of the powerful metal in the world. We are using Maharajatam. Cobalt is Maharajatam. Maharajata Basma is anti-cancer. So now cancer drug is changed from iodine 132 or cobalt 60. Now Western people are working on arsenic based anti-cancer drugs. So arsenic is one of the na visham vishamityatu tamrantu vishamuchyate. Tamra is powerful anti-cancer and it is very good drug for Wilson disease. Wilson disease is ceruloplasmin rise and Tamra basma is opposite. There is one Japan's theory for metallic shift theory. It says if Tamra is increased, you give Yashada basma. So in Wilson disease, if you give 8 milligram Yashada basma, it is going to convert the Tamra toxicity in the blood. So Yashada basma is also powerful drug for COVID-19 virus. Unfortunately, people went behind yellow turmeric milk. It is unfortunate. 3,000 proposals were there in front of the government of India for COVID-19 molecule, and the people given no regulatory authority to start trials. But the powerful drug is zinc. Zinc is a powerful rasayana for viral infections. Any virus or antiviral therapies, we can start with Ayurveda. So a lot of scope is there for rasayana chikitsa and degenerative branch. So with this, Avabodhini should start degenerative as one of the super specialty practice in Ayurveda, where Dr. Murulidhara has proved with his clinical trials. I am thankful to organizers, Dr. Ramakrishna sir, and all the Avabodhini 2.0 and chairman Dr. Shailaja madam. She is my senior in my undergraduate, and I am also thankful to all patient audience, very intelligent and patient audience. This is Gnanavati Parishad, and this is a Gnana Dasoha. Actually, you are giving food to the stomach and also food to the brain. A wonderful work done by Sushrutha Medical College, where Prakriti program is going on in the India. You are also doing along with that this beautiful workshop, and I once again thank you, and giving me an opportunity was really remembered lifetime. Thank you one and all. Namaste.
Thanks to both the chairpersons to enlighten all of us about degenerative disorders. I thank our speaker, Dr. Murulidhara Bhat sir. Sir has shared various clinical stories. All researchers over here, we got guidance from you, sir, to plan further research studies, and also your explanation regarding Jwara, Gulma, Prameha, and also sphincter-related disorders to understand symptomatologies and at the same time to plan treatments. It was very informative for all of us. Thank you, sir.
Now request all the dignitaries to come over the dais to felicitate the speaker. Our Honorable Director Sir, Dr. B.R. Ramakrishna Sir, Dr. Prasanna Narasimha Rao Sir, Principal, SDM Institution, Director, SDM Institutions, Principal, Sir Giridhara Vedantam Sir, Principal, Sushrutha Ayurvedic Medical College, Alok Rao Sir, V.B. Reddy Sir, we request Sangamitra Madam, MS, to come over the dais. Vice Principal Madam, Dr. Soumya Madam, to come over the dais. We request dignitaries to hand over token of appreciation to our chairpersons. I invite Dr. Shailaja U. Rao ma'am to receive token of appreciation from our institution.
request Dr. Madhav Diggavi sir to accept our token of appreciation. There is a small announcement for all the delegates. All are requested to drop your queries or questions into the drop box kept in front of the dais.